Hello, this is Dr. Neil Baum from New Orleans, wanting to provide you with suggestions on how to identify a telemedicine vendor for your practice. It wasn't but a few months ago that just 3 to 5% of urologists engaged in telemedicine. But as of February 20th, 2020, the federal government waived the HIPAA regulations associated for providing virtual care. And I estimate today that 60% of urologists have engaged in telemedicine. As a result, being a provider that offers telemedicine is going to be a necessity rather than an option. This is going to be a 7-minute video on how to identify a good vendor that fits your needs for your practice. Begin by asking the vendor how long they've been in business. Many of these vendors have been in business for over a decade. And I would recommend a vendor who has at least several years of experience rather than a startup. You want to be sure that your vendor has experience with urology practices. You don't want to be the first urology practice that they have as their clients. You want to look at the return on the investment by identifying what is the cost of the product. And it is reasonable today to ask the vendor that once you sign a contract and make a down payment, that they allow you 90 days in order to make your first payment, because it will take you at least that long to be reimbursed for your telemedicine visits. You want to also know about the estimate of how long it's going to take for the integration. And then you want to ask about updates, and that they should be at least once a year. And also, there should be no cost for updates for their program. You want to make sure that your vendor has experience in our sector of urology. You want to make sure they are aware of federal and state laws that impact your practice, and can you treat a patient who lives in another state using telemedicine is one example. Very important that the program that you select is able to integrate with your electronic medical record program as well as your practice management system in order to be able to bill third-party payers. You want to know if the program can be customized for the unique needs and wants of your practice and what is that extra cost. Also, it's going to be very important that the program that you select is HIPAA compliant. Today, you are allowed to use free programs, Skype, Zoom, or Google Hangout, but those programs are not HIPAA compliant. They do not allow documentation, and they don't allow you to connect with your electronic medical record. You want to make sure that the program that you select has a business associate agreement, or BAA, and this is a bond of liability that binds both parties. So if there is a security breach, then that party, that vendor, is going to be held responsible. You want to know how their system works, and is it user-friendly not only for the doctors, but also for the patients as well. You want to be sure that they have templates that you can test that work in your practice. You want to make sure that the data that is generated from your telemedicine visits and your key performance indicators will be uploaded onto your dashboard. You want to know how many telemedicine visits you had in a week or a month. What was the time spent on telemedicine, and what income was achieved? You want to know the ease of documentation between your telemedicine visit and your billing program. Another feature that you want to look for is a rules engine. A rules engine allows the vendor to verify that the patient has coverage for a virtual visit, and then the vendor submits a clean claim to the third-party payers. This reduces denials, and this reduces your patients and money that is in accounts receivables. You want to make sure that the program offers good training for the doctors and the staff, and also that there is support beyond the initial training. For example, if you hire a new medical assistant, how will he or she be trained after your program is up and running? You want to make sure that the program provides good patient education and how the patient can easily access the telemedicine program. And then you want to be sure that they have good technical support. It's not reasonable or possible that they're going to be available 24/7, but they should be available from 7 in the morning until 8 or 9 at night in your time zone. So if you have any questions or problems, that your program is not shut down. You want to know if they have created any articles or white papers that promote the fact that a telemedicine program generates cost savings as well as enhance clinical outcomes. So you want to know if they are indeed on the front line and have generated any important articles that are pertinent to your particular practice. I recommend that you kick the tires, that is, contact other urologic practices similar in size as your practice and ask the experience of the providers, and if possible, find out what the patient's experience has been with that particular provider. This is a very important recommendation that you won't be sorry if you took a little time to find out from others what has been the experience with the vendor. So in summary, the telemedicine tube has been outside of the toothpaste tube, and telemedicine is going to be here to stay. We're not going to be able to go backwards. It's convenient for patients. It's good for doctors. It does result in cost savings. It can produce enhanced productivity for your practice. However, vendor selection will determine the success of your program. Final advice: vet your vendor. If you have any questions or you would like my white paper on selecting a vendor, please do not hesitate to contact me. I look forward to hearing from you. Thank you.